can this kind of technology and wearables actually predict our future health, like illness, maybe even heart attacks, who knows, and maybe even longevity? We don't know, but with us here to discuss this topic is our good friend here, Dr. Yaariv Khaykin. Thank you, sir, for joining, and let's get to it, right? So while we were kind of just spooling up the talking points, tell our audience a bit about you and what you do.
Great. Thanks so much, Sush, and thanks again to Cardiovisual for giving us this platform. So I'm a cardiologist and an electrophysiologist, sort of an electrician of the heart, looking after patients with heart rhythm disorders. I've been practicing now for just over 20 years, having done my training at the Cleveland Clinic, and I practice just north of Toronto, Canada. And in my practice, I have a lot of patients with arrhythmias, abnormal electrical rhythms of the heart, and so we've been using wearables for a long time. Now, to try to answer some of your questions, wearables are great devices at giving you a lot of very useful information. If you recall, when we were kids, people had these pedometers that counted your steps, or I think some of the first generation of pedometers, you actually had to press a button when you took a step. Obviously, we've progressed much beyond that. And the multiple devices we have right now, whether it's jewelry, watches, rings, etc., are very good at looking at our activity levels, particularly looking at how active we've been during the day, how many steps we've taken. And over the last little while, the devices have become also very good at looking at our heart rates, heart rate variability, sometimes breathing rates, sleep metrics, and other parameters. Now, we don't necessarily have evidence to say that just buying an Apple Watch or an Oura Ring is going to make you live longer. We do have evidence to say that if you live up to our standards, so to speak, in that you take your 7,500 to 10,000 steps a day, you stay active for 150 to 300 minutes a week, you get a good night's sleep of at least 7 to 8 hours, the chances are your longevity is going to be better. And the way I look at wearables, the wearable is a device that helps you get into that healthy range. It helps you live your best. It helps you live your healthiest. And there is data to say that in structured programs, patients who used wearables were more likely to get into those ranges. There is evidence to say that if you are in those ranges, you are likely to live longer and be less likely to suffer an adverse cardiac event. And so, in a way, the wearables can help us get there.
Yeah, there are so many though, right? There's rings. I've got the ring on, but there's rings, there's watches, there's vests, there's continuous monitoring, and on the chest wall. Can we distill it down to some of the common denominators of these things that help us, that this sort of gives us common information? Would that be possible to do, or are they all so different?
I think they're more similar than they're different, Sush. So the most common ones that we're used to are various watches. We've had the Pebble, we've had the Fitbit, we've had the Apple Watch. And the watches are really good at kind of giving you everything. It's a watch, obviously it tells you time, hopefully most of the time. It gives you alerts from your phone to keep you distracted. But it also counts your steps and it counts your activity levels. And in the last few iterations, the watches have also added additional metrics like monitoring your sleep. Unfortunately, watches are not that comfortable. I don't know if you've tried to sleep with an Apple Watch, but I have certainly tried doing that with my Samsung watch, and it's not the most comfortable thing to do. And so that led to advent of other form factors like rings. There is the Oura Ring. Samsung has a ring. I went to CES a couple of months ago, and there are about 10 companies, perhaps maybe more, that have various rings. The ring gets you very close to the arteries, so it's really good at monitoring your heartbeat. It may be really good at monitoring your oxygen saturation. And rings have generally been used more to monitor your sleep and make sure that your sleep duration is adequate. And they also help stage your sleep and know how much time you spend in deep sleep, how many times you wake up, and how much time you spend in what we call the rapid eye movement or REM sleep. And then many of these wearables, whether it's watches or rings, come up with various scores where they sum up your activity, your sleep metrics, and they tell you, how well are you doing on a scale of, 1 to 100, roughly.
Sure.
And as you said, in the case of the Ring, or in the case of Whoop, which is another kind of common
The band, right?
wearable that's available right now, right? Those wearables are really good at looking at your recovery. Are you at your peak potential? And what can you do to get there? Is it better hydration, more activity, longer sleep, better quality sleep? And the device sort of gives you a rough idea of how well you're going to be able to perform that day. Obviously, that differs from device to device and patient to patient. They're not, be all and end all. And at the end of the day, nothing is a replacement for how you actually feel.
Right. So let me interrupt you there because, I have a very competitive team at work, right? We're sort of, busy hospital ER setting. And my team tends to sometimes in their morning huddle say, hey, what was your score? And they compare scores. The difference is scores are now coming from the Oura Ring or the watch or the Whoop band. How reliable are these scores? How accurate are they?
So the scores are very good when they're based on activity levels. The devices are really good at activity metrics, with over 90% accurate in counting your steps and activity metrics. They're very good at looking at your overall sleep duration. They may not be necessarily as good at staging your sleep. They're not necessarily as accurate at precisely staging your sleep. But another thing that the devices are really good at is they're really good at looking at your heart rhythm in a case of some devices, and then being able to tell whether or not your heart rhythm is regular or normal or irregular. And in particular, we know that one of the silent killers out there is atrial fibrillation. We're a couple of days away. March 1st is the World Pulse Check Day, as it happens, as I found out online over the last couple of days. And atrial fibrillation is a very common arrhythmia. Heart tends to be irregular. It puts you at risk for stroke. And we know from the Apple Heart study and the Fitbit study that these devices, based on the quadruplethysmography, the PPG, the little light sensor at the back of the watch,
Sure.
or potentially on some of the rings, these devices are very good at, very sensitive at detecting atrial fibrillation. The accuracy was about 84% for the Apple Watch and as high as 98 in the Fitbit study. But what can make us even better at detecting the arrhythmia are monitors that can actually monitor your ECG. Now, watches are pretty good at doing it. Most of the watches now have the functionality where you have an electrode under the watch, and there's another electrode on the crown or on the face of the watch. And so when you put your finger on the watch, it completes the circuit and gives you what we call lead one, from left arm to right arm. And in that configuration, it can actually record a pretty good clinical ECG. A number of us have been using these in our patients. So for instance, my patients have had CardioCom devices, LifeCore cardiomobile devices, Apple Watches, Samsung Watches, and for years they would send me ECGs from that watch, typically by email or fax to our clinic. And anecdotally, I've seen kids who would go to their family doc or their pediatric cardiologist, and pediatric cardiologists would just not want to look at any of these tracings. And lo and behold, the kid grows up, they're 18, they show me all these tracings for the last several years, and I see that they had supraventricular tachycardia or SVT. So in that particular case, the kid undergoes ablation. We could never catch it on a conventional monitor, but lo and behold, they were able to catch it because they were having symptoms using their wearable.
Right.
Now, where we're going with that technology is, as you know, I've been working for a while with a company local to Toronto that's developed textile computing or smart wearables that are built on clothing, essentially smart yarn. Smart yarn is essentially fabric. I don't know if you can see it there. It's, it's fabric, like fabric of your, of your shirt, your tank top, your bra, etc. However, the fabric is made of yarn that has some silver in it, and it's able to transmit electrical signal. And so we now have technology where we can incorporate the wearable right in your clothing. You can have a polo or a shirt, a bra that can monitor you using multiple leads. The most common one that we use, it's Health Canada approved, and it's under review by the FDA, is a band device similar to kind of a garment or a polar strap, but there is no rubber, there's no silicone. It's very comfortable. The electrodes are these little elevated portions here that you can see with a concentration of the conductive yarn. The device has a little pod. The pod talks to the app on your phone, and from that phone, the ECG is transmitted to the cloud where it's analyzed in real time as well as after the fact using conventional Holter software. And so what that allows us to do, we have, with the current device, we have 5 electrodes that gives you 3 ECG leads of continuous recording. So long as the patient is wearing it, the ECG is being recorded. It's super comfortable. There are no skin reactions. Patients can wear it for days or weeks on end. The device itself is fully washable. You can throw it in the wash, with the rest of your laundry. Charge the little pod while you're showering, put it back on. And so long as you're being monitored, we're recording a clinical grade ECG across 3 leads that can then be analyzed using software. With future versions of the device, adding the PPG, as I already mentioned, the little light sensor that could tell you your oxygen saturation, blood pressure. Blood pressure is implemented on several devices as well as part of the PPG package, such as the Samsung Watch. We're going to have it as well. Down the road, things like bioimpedance, looking to see how much fluid you have in your chest, trying to prevent episodes of congestive heart failure, et cetera, et cetera. And being able to knit this technology on machines that are sort of like 3D printers in a way, we can essentially knit clothing that has multiple sensors and potentially even devices that can intervene. Imagine if you have a device like this that detects sleep apnea and then gives you a little jolt, kind of like your spouse, kicking you in the chest, to wake you up and get you to breathe again. We can potentially do it all from the device.
For a device like for a vest like that.
Excellent.
We'll talk.
All right.
That's amazing. That's amazing. So let's get into some of the obstacles. You mentioned something about the kid who had this thing, SVT, that was just gone unnoticed for a while. What are some of the obstacles in other clinicians that you have come across, and how do we actually help them educate and get them on the same page as physicians as yourself?
Right. Well, I think it's very important to educate not just the public, but it's very important to educate physicians. As you know, we have an overload of information. A lot of us come out of school, pretty knowledgeable, having done all sorts of certifications. But as we continue in our practice, very important to stay up with, medical education and technology. I find a lot of docs not necessarily very technology oriented, as I'm sure you know. So it's very important to make sure that the public knows that these devices are pretty accurate, and the ECG recordings from a lot of these devices are really clinical grade. Now, the next bigger obstacle, in my opinion, is just information overload. Imagine in our practice, we see about 30,000 patients a year, and we perform about 1,000 ablations for atrial fibrillation a year. If all of these patients were wearing these devices and sending us all of the episodes, and we had to look and adjudicate every one of those episodes, I wouldn't have time to do anything else. I probably wouldn't even have time to do all of that. I would probably need to have additional doctors, additional staff to be able to do it. So I think what we're in desperate need of is better way of triaging the tracings, reviewing the tracings, and organizing information in a way where it makes sense for us to look at. And that's where I really think the modern revolution with artificial intelligence comes to the rescue, where you can have a filter that looks at all of these tracings, reassures the patients if those tracings are normal, and alerts the physicians when they're not. And I think that's coming as a next step. That's coming down the line. And then a number of big EHR makers like Meditech, Cerners, Epics, you know, they all are developing integration with things like Google Health, Apple Health, et cetera, to bring this information into the mainstream kind of medical milieu and to show it in a way that makes sense for the physicians to interpret.
Right. That's fascinating stuff. Let's talk about applicability. Urban setting, rural setting. Are there differences? Is there more value in places like rural settings where healthcare access is an issue?
Right. I think this is a godsend for rural areas.
Mm-hmm.
You know, essentially having wearable devices and an internet connection makes everyone feel like they're next door to your doctor. You know, the pandemic has taught us to provide virtual care. You know, I know a number of us had been doing it before the pandemic, but it really blossomed. In our clinic, as I said, was about 30,000 patients, 50,000 visits a year. March 18th, 2020, we switched 100% into virtual care, and for a couple of years, all of our visits were virtual. So we know how to do it. We know how to do it really well. And so when the patient has a wearable that records multimodal biometrics, you know, your activity levels, your sleep, your heart rates, your ECG, and we can review it all remotely in a way that's organized for us in a palatable fashion and see the patient. And in fact, we have a prototype virtual portal where a patient wearing one of these devices, when the physician talks to them, I can see everything from their monitoring. I can see all their blood pressures, the back-end interfaces with every smart blood pressure device, smart scale, pulse oximeter, et cetera. So the data doesn't have to come just from this device. We can aggregate data from across multiple sensors and present it as an overlay. So when the physician is talking to the patient, I can see the patient, I'm talking to them, and I can see an overlay of their live biometrics, their live ECG, potentially live blood pressure, et cetera. It's really no different than having the patient sit in front of me in the office.
Right. And you work for Myant Health, right? Myant, and you are their chief medical officer.
Well, I work with Myant, but I'm a fully practicing electrophysiologist, work at a hospital, so I sort of wear a number of hats, and I was intimately involved with Myant developing this technology, you know, helping develop this technology in a way that makes the most sense to our patients and to cardiologists in general as well.
And how are they different, if you will, from the others? Are they the ones with the fabric, the yarn material?
Correct. You know, there are a number of long-term ECG monitors on the market. You know, historically, you know, you remember patients were wearing these devices that kind of look like a watch, like a Walkman. You know, the first generation of them actually were Walkman. You know, they had a little tape inside. The more modern versions have flash memory, obviously. But, you know, you have a device that's connected with a bunch of wires to a bunch of electrodes. It's ungainly. The patient doesn't like it. You know, there's wires. There are electrodes. Electrodes cause skin reactions. I've had patients return coulters to me where instead of taking the patches and the wires off their skin, they just cut the wires off their skin with scissors. There's all sorts of stuff that we've seen. We've seen them, you know, immersed in water before they became waterproof, you know, et cetera. Now, over the last few years, since the rise of iRhythm and others, we've seen an advent of patches. Patches have been great. You know, you don't have the wires. You have a device that's kind of stuck to your chest. It provides you a continuous ECG recording for however long the battery longevity is, you know, typically a couple of weeks. But you're still dealing with a device that's stuck to your skin all the time. It potentially causes some skin irritation, although some of the more recent patches have been fairly hypoallergenic. In their basic design, most patches just give you a single vector. They don't give you other ECG electrodes, although the more recent patches, again, add additional stickers that potentially give you additional vectors. And that's where around 2014, 2015, you know, knowing that we're monitoring so many patients, I started looking for a partner that would develop technology that would be just much more seamless and obtrusive and more comfortable for the patients to wear. And Myant has been a great partner in designing this technology. They had this technology, and we kind of directed it towards cardiovascular multimodal monitoring, and that's where we're at right now.
That's outstanding. That's great. I think it's going to be, the future seems very promising, doesn't it? Hey, look, we have a whole bunch of questions here, and to kind of keep within the time frame here, so I thought we'd do some of these questions. Are you ready?
Absolutely.
First question here is, how do you see the future for these devices? Or what do you see? What do you see as the future for these devices? In other words, I think they're asking, what populations who would benefit the most from them?
Well, you know what? I really think that it applies to everyone because these devices are now, particularly the device that we're working on is incorporated into clothing.
Mm-hmm.
It may be used. There's a children's version. You can use it in babies to try to monitor for sudden infant cardiac death and monitor ECG in a baby. The same technology allows you to sense pressure. You can use it in bed sheets to monitor, the baby's movement. You can monitor it on the other end in the elderly to monitor and prevent pressure sores from forming by just monitoring pressure. I see a scenario where, you're an emergency physician, a patient comes into the emergency room, they, as soon as they say hello, they get a monitor. They wear this monitor. By the time you see them, you have all sorts of biometrics, much richer biometrics than what you get right now to help understand their health state. They then wear it throughout their hospital admission, potentially, into the OR. So long as they don't need to have their chest open, they can have a monitor. Your handshake past the biometrics from hospital monitoring into intraoperative monitoring. You save about 10, 15 minutes in terms of time that you'd otherwise take to hook up the patient to all the machines that monitor them in the OR. Then they go home, continue to be monitored through home care or hospital at home type service. And then when you add that AI platform that I described, we can look at these biometrics for a number of secondary sort of things. There are companies now that are looking at ECG as a diagnostic that doesn't just diagnose your heart conditions or arrhythmia. There are algorithms that have been developed where you can use ECG to tell your potassium level, your calcium level, your level of BNP, your blood sugar level. You can use the ECG to diagnose aortic stenosis, pulmonary hypertension, coronary artery disease. You can use it to potentially predict an episode of atrial fibrillation. We're in a large study right now to try to do just that and see if we can predict an episode before it occurs. You could potentially use multimodal biometrics, including ECG, respiratory rate, transthoracic impedance or bioimpedance to try and predict an episode of congestive heart failure before it occurs so that you can intervene and prevent that patient from having, an adverse clinical event. And the idea is that the more data we've got, the scalability hypothesis suggests that the model gets better and better and better the more data you give it. So can we get to the point where we know when something's going to happen well before the patient becomes aware of it, where we get aware at the preclinical state, intervene at the right time for the right patient with the right type of approach, and prevent an event before it ever becomes clinical altogether?
Yeah, so I think that's a great point. And from an emergency medicine standpoint, we have such incredibly long wait times in the waiting room. I'm talking about 6, 7, 8, 9, 10 hours. When patients come in, if they're sitting in the waiting room with one of these monitors on, the amount of information we can get from them would be quite significant, I think. So, hey, quick, next question here is, here. How can we assess, or can we assess raised blood sugar by the ECG?
Well, these algorithms are not necessarily yet clinical, but ECG is a very rich signal. And there's a lot of work being done by a number of companies to look and see what data we can extract from that signal. There are companies that are actively working on correlating CGM data, continuous glucose monitoring data, with ECG in the same patient to see if they can find correlations. And preliminary research looks promising in terms of being able to tell the range your blood sugar is in just looking at your continuous ECG.
Okay.
The same goes for other electrolytes. There are a number of companies that are looking at predicting or diagnosing potassium levels, calcium levels, etc., based on the ECG signal by itself. So there's a lot of signal. It's locked in the ECG. It's not something that's apparent to the naked eye. but these new AI algorithms can make it happen.
Yeah, that's amazing. Next question here is, many wearables are marketed to younger, tech-savvy users. So how can we improve adopting this model into older patients? And that feeds into another question talking about the potential use of these devices in nursing home patients. What are your thoughts?
Right. Well, clearly it's easier for the younger people who are more tech savvy to use it. And, you know, even if they're completely healthy and there's nothing wrong with them, as I mentioned before, wearables are great at directing you to change your lifestyle in the most positive fashion. And to people who actively train, athletes, it allows them to improve their endurance and, incrementally improve their performance during competitions. In the elderly, it's a little bit tougher. I find, and we found during the pandemic when we started providing virtual sessions, that a lot of our patients have landlines and flip phones, don't necessarily have internet, and whatnot.
Right.
So one way to apply the technology is not have a fancy screen on it, which elderly may or may not potentially be afraid of, like an Apple Watch that gives you a lot of information, bells and whistles, that may get somebody easily confused. That's where a monitor such as Myant, monitor such as Whoop, your Aura Ring, there's no display. It doesn't actually tell you something while you're wearing it. You're wearing it, that data goes into the cloud and it gets processed either on edge by your phone or your watch, or it gets processed in the cloud. And for the elderly, let's say in a nursing home, patients may be wearing the monitor. The AI layer could be analyzing the data coming from that monitor. The monitoring data doesn't have to come through your phone. Right now, the paradigm is such that it comes through your phone. But in a setting like the hospital or a home, you can have a hub, and we have a prototype where a hub is placed. The hub sees the devices in its vicinity, and that hub is used to channel the data and pre-process the data, before it gets sent to the cloud. And then the clinicians looking after that patient, whether it's concierge care, whether it's their physicians, then get aggregate data presented in a way that makes sense for each individual type of provider. So cardiologists may need to have a different view than a respirologist and a sleep specialist.
Great
and
point.
The idea is that down the road, you can use this device for everything, from heart rate variability, respiratory rate, home or, hospital sleep study, you name it.
Yeah, great points. Fantastic. Let's take another one here. For patients with heart failure, for example, what key metrics from wearables should they focus on, and how can this data guide their management?
Right.
They're asking about heart failure patients now.
Right. Well, we've been trying to crack that nut for a long time. There's been a number of devices that provided additional metrics in patients with heart failure, not necessarily wearables. I remember implanting Chronicle devices, which were made by Medtronic, I believe, and had an actual pressure sensor that was sitting on a catheter in the right ventricular outflow tract, in the heart, measuring the pressure. There were devices that were implanted in the left upper chamber to measure the pressure. Most recently, we have CardioMEMS devices that monitor the pressure right inside of the pulmonary artery. And it's sort of it's not a wearable, but it's sort of a wearable in a sense that the device is powered by a special pillow that the patient sleeps on and gets a reading from the device on. We know from multiple devices, pacemakers, defibrillators, that you can see a significant change in the impedance across the chest well before the patient becomes short of breath. So as the lung gets wetter, the impedance falls. And
no kidding, really? Wow.
Right, and implantable devices, pacemakers, defibrillators, for instance, Medtronic had this algorithm called Optimal for the last, maybe almost 20 years. And you can see when you see these patients, you can see, Easter, Thanksgiving and Christmas very clearly reflected in their transthoracic impedance.
That's unbelievable.
And so combination of seeing arrhythmia burden, heart rate, respirate, temperature, and impedance is really useful. For instance, a heart failure patient may get a faster heart rate, but be less active as they're getting worse. So if you have a device that tracks your activity levels and heart rate, and you can see that they're going in opposite directions, something is wrong. If you can see on top of that that the transthoracic impedance is changing and the lung is getting wetter, but those are kind of the things that are, that they make sense. They're not a black box. They kind of make sense to us kind of teleologically, when you and I chat about it and look at the actual live metrics. Now you add AI into it and you put a lot more information. I believe we can get to the state where the algorithm can detect these changes well before you and I can see it with the naked eye.
Yeah, that's the thing, right? Can they look into the future of an impending process, heart attack, things like that? So someone's asking you here whether or not you have seen wearables actually change patients' behavior, behavior for the better, and if so, in what way?
Definitely. So there's lots of studies to look at patients using wearables to improve, again, their exercise, for instance, so their sleep. And studies have shown that in a structured program, when wearables are used, patients are about 30% more likely to get to that step count or activity levels where we want them to, about 20 to 30% more likely to sleep long enough and potentially avoid untoward behaviors like, having caffeine after 5 o'clock, having a late meal, having screen time right up to bedtime, all sorts of things that prevent you from getting that good night's rest. So there's lots of data to show that the wearable devices can help you get into that healthy range. And anecdotally, I've certainly seen it in my patients.
Right. Really important stuff. Amazing, actually, to learn so much about it here. So thanks so much for that.
Now, they're actually, and it's not just me believing in it. When the insurance industry believes in it, it must work, because there's dollars and cents. And Manulife has this vitality program where patients who have Manulife coverage actually can get an Oura Ring or an Apple Watch or a Fitbit, and then Manulife gamifies their performance. So if they get into the right number of steps, the right sleep duration, et cetera, they actually get points that can lower their insurance premiums or give them gift certificates and such. And they've published their data showing that overall it led to fewer adverse outcomes in the insured patients.
So gift certificates for healthier food,
exactly,
and your rates go down. It's unbelievable, right? So it's that's a whole different discussion. It's oh boy, that's a really interesting one. We'll chat more about that at a future date. There's one more question here, I think, and the question is, can ECGs help in assessing the heart condition patterns to predict even conditions like autonomic dysfunctions, as many chronic disorders affect the body in that way? So interesting question. Very interesting question.
Right. So there may be a couple of answers. One, I'm sure, again, with AI analytics, we may be able to get more in-depth information and get to the bottom of some of the conditions like, POTS and others.
Yes.
However, at the very basic level, all of the devices that are looking at heart rate can give you data on heart rate variability. And we know that heart rate variability is intimately associated with your outcomes. If you have higher heart rate variability, you have to be in normal rhythm. If you're in atrial fibrillation, kind of all bets are off, because in atrial fibrillation, you have a lot of heart rate variability. But so long as you're in normal rhythm, higher heart rate variability is associated with better outcomes, and conditions such as having a heart attack, major depression, et cetera, are all associated with lower heart rate variability and worse outcomes. All of these devices report heart rate variability to you, and you can then use that data to see kind of how healthy you are in the range of patients such as yourself.
And the numbers like less than 20, right? Is not good for you. Is that correct?
Well, you want it to be more. You want it to be higher. You want it to be
less
more
is worse, right? It's less.
Correct. Right.
So,
right.
Yeah.
And so and the ranges are going to depend. The ranges are going to depend on your age, your conditions. They're also going to depend on how fit you are. So athletes are going to have better heart rate variability than somebody who's not an athlete. And the idea is, with you trying to practice these healthy behaviors, to increase your heart rate variability. Now, heart rate variability can be split, and essentially, the wearables just give you a number, and that number is typically this root mean square, or RMSSD. It tells you a little bit more about your parasympathetic nervous system. But there's lots of different ways of looking at heart rate variability that allows you to tease out your sympathetic nervous system, that's your adrenaline, you're running away from the tiger response, from your parasympathetic nervous system, that's the system that puts everything to rest, puts you to sleep, etc. And heart rate variability can be looked at kind of in a very dynamic way to see which of those systems is more or less active at any given time or in response to different stimuli. So there's a lot of data in heart rate variability. And again, as we add continuous monitoring and AI platforms that can look at it, I'm sure there's a lot of data we can glance from it that's not necessarily even apparent to us at this time.
It's amazing to me to see patients coming in and then telling me what their average HRV is over the past 6 months, and I'm kind of blown away. Like that level of understanding is really quite sophisticated to me, and for patients to see this, understand it, and to use it, and to really make sense of it is quite phenomenal, I think, don't you?
Right. And add to it, there are other parameters that we're not necessarily even monitoring right now. There is data where voice analysis could predict an episode of congestive heart failure 30 days before it occurred. The study like that was presented last year. There is voice analysis that can do a full, cognitive analysis of the patient, similar to doing it, to having a neurologist or a psychologist do it. So wearables currently don't necessarily incorporate voice, but I think that's something that we're going to see more and more as the data becomes apparent that voice is yet another biometric that we need to look at.
Unbelievable. Really is quite amazing. So hey, look, we are I think we're pretty much up to our time limit here. I know there are a few more questions, but guys, send us your questions, DM us, and DM Dr. Khaykin. I'm sure he'll be happy to take more questions from you. But we're going to go ahead and wrap it up now, wrap up this discussion, and I'm sure we'll be speaking with you again about more of these things. So so thank you so much, guys. Do you have any closing thoughts before we go?
Thank you so much for having me on this program. Really my pleasure. And again, happy to answer any questions. I don't tend to use Instagram as much as I probably should, but you can definitely find me on X or LinkedIn. I believe my X handle is Heart Ablator, because that's what I do most of the time whenever I don't talk about wearables.
Okay. Well, we'll put that in the show notes, and so people can track you down in that way. So thank you so much, Dr. Khaykin. Thank you so much for being here, and everybody else out there, thanks so much for joining us. And Cardiovisual, thank you for hosting this episode. Really appreciate it. I'm Sush Prusty for MyHeartMD. Until next time, take care.